Hello there and welcome to the hospital. So sorry to hear about the bump to the head. I'm going to take some notes. So can you tell me what time this happened, please? When did it occur? And how did the accident occur? Okay, have you experienced any vomiting or dizziness since the accident? Has there been any changes or loss of vision in either eye? Have you noticed any double vision, either horizontally, vertically or diagonally? Have you noticed any flashing lights in your vision or an increase in floaters? Okay, and how are you feeling at the moment? Okay, so I see you've placed a plaster over the wound, so what I'm going to do is I'm going to remove the plaster, have a little look at the wound and just document before doing anything. Let's remove this plaster. Let's have a little close-up inspection of the wound. So I can see that it is weeping. Right side of the forehead. Approximately 3 millimeters in width. Height of the wound, 2 millimeters. And as we say, it's just weeping and bleeding a little bit still. So the clotting hasn't fully worked yet, but we're getting there. Okay, just raise your eyebrows for me. Now blink, smile, turn to the right and turn to the left. Full range of movements there. Okay. Just going to take a tissue, just gently dab the wound. By applying much pressure, I'm just going to absorb some of the excess here. Okay, it's a fairly deep wound, but I don't think we need stitches. So that's got a little bit of the excess there. Right. I'm going to have a little look in the first aid kit here and take out all the equipment required. Let's have a look. Scissors. We have a little wound dressing here, a little wound dressing for you. We are going to need some micro-porous tape to apply the dressing, to attach it safely. And we just need to give the wound a little clean with this non-sting wound cleansing wipe first. Okay, let's begin. Just going to dab the area just surrounding the wound, the right side of the forehead there. Just going to get it as clean as possible. Blood, plasma. Hopefully that'll be the end of the weeping. Okay, let's get the wound dressing prepared. I'll attach that with some tape. It's a good idea to leave the dressing on for about 5 days. Try not to get it wet when you're cleaning your face. Just clean around the dressing, please. And obviously just be very careful when you're washing your hair. So the surrounding area is nice and clean there. Okay, let's access the wound dressing. This is a 5 by 5 centimetre one. That is the wound dressing for you. Just take a little bit of microporous tape. We go. Let's just apply this over the wound for you. Okay, that's looking fine. Just going to wipe just on the nose. A little bit of blood there. Okay, so the wound dressing is applied. We have the microporous tape there. Leave on for 5 days. Now, a little bit of information. This leaflet here, which just reiterates what we've gone over. This is the wound care leaflet to take away. Injury. Now, if you experience any dizziness or vomiting in the next week, you must come straight back to A&E and we'll investigate. Likewise, if you experience any loss of vision, changes to your vision, double vision, whether it's like this, this, or this, or if you experience any flashing lights or an increase in floaters, that could be a retinal issue, you must go straight to your optometrist if those symptoms occur. Okay, so before I let you leave, I'm going to get the doctor just to do a few checks. So just have a seat in the waiting area and he'll be with you very shortly. There, the doctor just want to do a few checks before we let you leave. So how did this accident happen? Is your vision okay? No double? No flashing lights? No floaters? Let's have a little inspect there. So the nurse has bandaged you up well. So we'll just do a few brief medical checks and then I'll let you go. Okay, just looking over my shoulder into the distance. Right, keep looking into the distance, please. Pupils are looking fine. There's no nosocoria and they work normally to light. Now, your job is to follow the light here, keeping your head steady. Good. Okay, just follow my finger this time, tip of the finger. Good. Okay, looking into the distance you'll see that there's a letter chart. Just there. I'm just going to start by covering your left eye. I want you to look at the chart, read down as far as you can for me please. Tell me when you can't go any further. Any more? Are you sure? Okay, let's cover the other eye. Looking at the chart through the left eye, read down as far as you can for me please. Tell me when you can't do any more. Right, do you wear spectacles for your distance? Might be worth an appointment with your optometrist to see if they can improve your vision a little bit, because that wasn't so good. Right, what do we have next? Let's have a little look at the back of the eyes with the ophthalmoscope. Just involves me coming a little bit closer just to ensure that there's no such issues as detachment, retinal hemorrhages and all those nasty things that can occur as a result of head trauma. Okay. Your job is to look straight ahead to begin with. Right, let's come a little closer, please. Okay, I'm not seeing any swelling at the back of the eye there, just look into the light. The macula is fine. Looking right, up and right, up to the ceiling, up and left, left hand side, down and left, straight down, down and right. Look straight ahead again please. That's looking fine through the right eye. Let's observe the left. Keep looking straight please. Now look into the light. Look to your right hand side, up and right, straight up to the ceiling, up and left, directly left, down and left, down to the floor, down and right, look straight ahead again, take a blink, retina is intact, optic nerve looks fine, as does the macula, right eye and left. Okay, so I'm sure the nurse has given you a little bit of information about returning if you experience any additional problems. The wound should completely heal within 10 to 14 days. If it continues to weep, bleeds more, if any double vision, loss of vision, give us a call and we'll try and see you. But that's everything today, and I'll let you go now.